Each year, thousands of lives are saved by one diagnostic test, the mammogram. Mammograms have reduced breast cancer deaths by nearly 1/3 since 1990. When caught early, breast cancer has a survival rate of close to 100%, which is why it is so critical that women across the country get screened annually. However, statistics show women in underserved communities often fall through the cracks.
The aha moment for me about the dangers of breast cancer occurred early in my career, when I was in my 30s, knowing someone that had breast cancer that didn't make it and left behind her husband, her 2 children. That's when it really struck home to me that that could have been my wife. Those could have been my kids. I could have been that husband. That's when it really hit me how dangerous of a disease and how devastating it can be for yourself and for others.
Breast cancer is the most common invasive cancer diagnosed in women and is the second leading cause of cancer death. We've all heard the statistic, 1 in 8, which translates to 12 to 13% of women will be diagnosed with a breast cancer in their lifetime. Fortunately, over the last several decades, we've made tremendous improvements, and most of these women will not wind up dying from their breast cancer. Unfortunately, these advances have not been even across the board. Women of color and women who live in underserved or low-income zip codes are more likely to wind up dying from their breast cancer. Women in these areas often do not have access to early detection. There also seems to be something inherent in the kinds of breast cancer that these women develop, and so additional research focusing on these differences and how we can best serve these communities is also necessary. African American women tend to be diagnosed at a younger age and are more likely to develop aggressive breast cancers, which don't necessarily respond as well to the treatments that we have available.
Some of the ways that we can reach the underserved include meeting people where they are. So that's why we have a mobile mammography unit. It does go out and it meets people where they are. It could be at schools, it could be at businesses, it could also be in underserved areas. To increase the affordability and the accessibility to the services that we provide, it begins with awareness and then also making people feel comfortable in expressing themselves. And that's why we have navigators who are so talented, because in many instances they've walked that walk before. They know how to communicate with someone that may be in those circumstances.
Chesapeake Regional Healthcare and its community partners work together to provide services through Southeast Virginia. Together, these organizations work collaboratively to make an impactful change that helps to solve breast health inequities in this region.
I am a breast cancer survivor, and I treat people the way I would like to be treated. I want people to know that we will care for them regardless of their ability to pay. It doesn't make any difference to us. We want to care for them, and we want them to get them into survivorship and also to thrive, not just survive. We've partnered with Brahaha, which is a seriously uplifting event. It's an event that is community-based. So people in the community, businesses, they decorate bras. We have an award and auction show, which is always a really great time. We have a 5K, which starts here at the Jennings Center. We've raised almost $2 million over the years, and the funds have gone to provide mammograms for uninsured and underinsured women, as well as for technology. One of the big things that we've helped fund with Brahaha is our mobile mammo van. We call it our big pink girl, and she goes everywhere. And what it does is it brings mammography out into the community to again provide access to women so they can have mammograms in their communities.
So I was diagnosed in September of 2018. I was referred to Chesapeake Regional Healthcare to help me understand what might be happening with me. Immediately when I began to go to my appointments, I was introduced to Dr. Ruiz and Meg. There are really no words to describe how instrumental she has been in my breast cancer journey, but even afterwards. What took it over the top for me with Meg, and I knew that I was in the right place with Chesapeake Regional Healthcare, she gave me her personal phone number. And she told me that if there was ever a time that I had questions or if I needed help with anything, that she was going to be there from beginning to end, and she has never failed me.
Making sure the community has access to proper diagnostic technology is just the first step in Chesapeake Regional's commitment to lifetime care. Staff are dedicated to providing individualized support for patients, from diagnosis to recovery and beyond.
You're going to see your medical oncologist for 10 years. So we want to make sure that we have people that are comfortable. We want to make sure that you actually partner with your physicians. That's one of the things that I do as a navigator, is I find partnerships. They need to be comfortable and confident and know that it is a partnership and know that they're going to be well cared for.
For more information, please visit chesapeakeregional.com.